One.
Hello, everyone. Welcome to another episode of Dr. Plano's Plastic Perspectives. Today is December 27th. I'm Dr. Jeff Angobaldo, board certified plastic surgeon, otherwise known as Dr. Plano.
It's tough. That sounded really good, but this would be a good opportunity to keep it. What's it called? In reality, it's December 27th. I hope you all had a Merry Christmas.
Oh, yeah.
Let's say something like that.
All right. Hello, everyone. Welcome to another episode of Dr. Plano's Plastic Perspectives. Today is December 27th, and for you celebrating, hope you had a wonderful Merry Christmas and happy holidays. I'm Dr. Jeff Angobaldo, a board certified plastic surgeon, otherwise known as Dr. Plano. Today, our plastic perspective will be focused on the breast lift with implants. The breast lift, it's also known as a mastopexy, and breast implants are also known as breast augmentation. But both of these breast surgeries can be combined, and are cosmetic surgeries designed really to enhance the appearance of the breast. Yeah, I look at it like this: implants restores volume, while the breast lift changes the shape. And so it really addresses, sagging and volume loss, which will occur with pregnancies, breastfeeding, or with weight loss, or a combination of both, or even genetics. We've operated on patients before children, before they had kids. They're younger, between 20 to 25, but they just genetically, they had their nipples are low, and their breasts are flat. So it's just genetics too that can contribute to the shape of the breast. So a breast lift with implants, really restores a lot of confidence and self-esteem in our patients, and that's why we choose to do it. We had another segment last week discussing breast implants. So if you want to hear more details about implant surgery, you can hear that podcast. But we'll touch base on implants also because we're combining a lift with implants. The lift itself, we talked last week, the implants, there's only an incision that's maybe 1.5 inches or so along the breast fold. So it's not very visible. But with the breast lift, if the nipples are low, then there's actually scars associated with that. And the scars will depend on how much that nipple areolar complex has to be lifted. For example, if it's only like a 1 centimeter lift, you can just make a small donut incision, so the scar will be around the areola only. But most people need more than just 1 centimeter or so. If it's 1 inch or 1 inch to 2 inches, you can do what we call a lollipop incision. So you have that circle scar around the areola, and it goes all the way down to the breast fold. If someone's nipples and areolas are lower than that, more than 1.5 to 2 inches, or there's a lot of breast volume at the base of the breast, we'll still do the lollipop incision, but it becomes more like an anchor at the base. So it's like an anchor incision, and that incision at the base is important to take out any loose skin. If someone has a lot of volume at the base, also we take out some breast tissue. So those are the three, different types of breast scars that we use and utilize for our breast lift techniques. And all a breast lift does is to reshape these breasts. They're sagging, they become more firmer, they become more of a youthful contour. And if someone's asymmetrical, a breast lift is great because what we do is we take out more tissue from the bigger side. But, no one can make someone symmetrical. I always refer to breasts as sisters and not twins. No one can make them identical, but they're a lot closer than how they look beforehand. And there's always going to be a nice improvement in the size and the symmetry of both breasts with this surgery. And obviously, the reason why we do is it makes patients feel confident. Their self-esteem gets a boost. They fit nicer in clothing. They look more proportionate with their bodies. And it really addresses some of the stuff that occurs with having children or weight loss. And this can be performed without changing or increasing the size of the breast. But in general, a breast lift tightens breast tissue and skin. And so, my experience, it makes a breast look about half a cup size smaller. And a breast lift doesn't change the cleavage or the volume superiorly. So if you like that kind of ski slope shaped breast that looks very pretty and natural, all someone would need would be a breast lift if they have volume. It's hard to do a nice breast lift with just an A cup or a small B cup breast. I always recommend an implant to give them a little more volume. A breast implant is done simultaneously with a breast lift to restore two things. It gives patients better cleavage and gives them that volume superiorly that they've lost from breastfeeding. So that's what, if people want more volume superiorly, that's when you think about adding an implant. This surgery, when you combine them, has a higher risk of complications because a breast lift tightens skin. You're removing it, you're tightening it, creating a nice, pretty circular shape. And then what does an implant do? It stretches out the skin. So you gotta be conservative. We always put sizers in first. Sizers are disposable implants. So in the surgery, before we actually use the real implants, we use sizers, which are disposable. And we put them in to see if they match symmetrically. We also put them to see if we can actually close a pocket without any tension. So that's what really determines how big an implant we can place in someone. And so we use sizers quite frequently with all of our breast augmentation surgeries. Now, as mentioned in our last podcast last week, what does implants do? We just mentioned they increase your volume superiorly, the fullness. It actually helps restore some of the shape a little. The breast lift really targets the shape more than the implants, but the implant gives that breast volume. So just to reiterate, in case you were zoning out, the breast lift and implants, the combination surgery addresses the sagging, the loose skin, and the volume loss that occurs with weight loss or pregnancy and breastfeeding. Some of the complications that can occur, because you're combining two things, two forces, the breast lift tightens skin while the implant stretches it out, there could be some complications like some skin slough, meaning because the skin's pulled under so much tension and the implant puts pressure, some folks can develop a little bit of necrotic skin, a wound that can occur. And that can take, a week to a few weeks to heal. So that can happen. The combination, the risk of complications are about 20 to 30% when you combine an implant with the lift. But that's why you go to a board certified plastic surgeon, because if you have a complication, we know how to address it. All of your questions will be answered and you'll be reassured. And usually when someone develops a wound in our office, we'll see them every week until it heals. Other complication that can occur is a seroma, which is a fluid collection. I've never had a patient in private practice in the last 15 years ever develop a seroma with breast augmentation surgery. But that can happen, a hematoma. I can recall one patient that had a small blood collection after surgery. And at that time, her husband called the on-call phone, which was me, a few years ago. And his wife was vomiting and people get nauseous after anesthesia, especially taking pain pills. And when you throw up, that force increases her blood pressure. And then he told me that she started swelling in one breast. So we scheduled her the next day and we took out a little blood and placed a drain and she did fine. But yeah, so, they say if you have complications, you haven't operated enough. So I definitely do remember one breast bleed that occurred about 8 hours after the surgery was completed. And it was addressed the next day. One thing that can occur is implant malposition, and that's when sometimes the implant gets stuck or it gets too low. So, and that's easily addressed if you refer to our last segment, how we correct malpositions. It requires small surgery with anesthesia because that's something you can't do awake, and putting some sutures to close out the pockets, because with a malposition, the implant drops a little bit lower than the fold, or it goes to the side a little too much. Because these round implants are made to move about an inch side to side, up and down. But if they move too much, Let's say you're laying on your back and your implant goes into your armpit. Yeah, that's a malposition. It's migrating too much to the side. So internally, we do sutures on the inside to put the implant back in the medial position. So yeah, stuff like that we can address, but that's also a complication that can occur. What I've seen more in my practice with breast lifts, the combination with implants, is small superficial wounds that can occur, and they heal within a couple of weeks. Another complication that we see is just some people can lose some nipple and areolar sensation, and that is definitely significant for many patients. The risk is higher with breast reductions at like 20%, but lifts, we're not taking out so much tissue, so it's less. And some people can become hypersensitive, or some people that didn't have any sensitivity become sensitive after surgery. So either way, every time you're cutting through skin, tissue, it can affect the nerves in that area. We talked about malpositions. The other thing is some folks that have bigger breasts can have a little bit of drooping at the base. So a breast lift lasts about 10 years, especially for people with a size C cup breast and higher, because there's volume, and still over time that skin will relax and that tissue will start to drop and you become flatter on top. That is all normal. And so in those patients, I always say, just like a facelift, these surgeries last about 10 years. If you want to be perfect, the nipples don't drop that much though. The nipple might drop less than an inch over 10 to 15 years. It's that the tissue becomes more boxier as the years go on. We also address capsular contracture and ruptures at our last podcast. Please, you can hear more information about that. But there is a warranty on contractures when the implant gets hard for 2 years. And there's also a warranty for a rupture, which doesn't happen very often. And that's why there's a warranty for 10 years. One of the biggest discussions that I have on consultations is to make sure someone's realistic about their results. When someone doesn't have much breast tissue, they're an A or a small B breast, there's not much tissue there. So the implant actually takes the shape of the breast. They look full, they look round, and they look great with their lift and implants. But when someone comes in with a very, like a C cup and higher, there's breast tissue there. Their implants look more natural. And the patient that's a double D natural, deflated from having children, but she's still a D cup and higher, and they look at before and after pictures and they're gravitating and they want the look of that implant look, a round look. And that can only be achieved on someone that has a A cup or a small B cup breast. So we try to give people realistic expectations. We match their breasts with the after photograph in our PowerPoints to say, look, it's nice and round, you have a change in shape, the nipples are elevated, you're more symmetrical, but you have breast tissue. You're a D cup naturally. We can only take out so much. It's not really a breast reduction. We're doing a breast lift, which we take out just a little tissue. So that's why, if you give them they have to have realistic. That's why it's very important to have realistic expectations with our patients. Now, if someone has a natural deflated D or double D or triple D breast and they want that implant look, then it's a 2-stage surgery. We're doing an aggressive reduction first, a breast reduction, where we're taking out tissue, making them a B cup breast, and we wait 6 months and we place an implant. Then they'll have that look that they desire, that fake, I have implant ball look. But most, the majority of people don't really want that. They want just some volume restored superiorly and some cleavage, and that's what the implant gives you, a more of a natural feel, especially with people with larger breasts. The 2 things that we check for all of our surgeries in the morning is to minimize complications is the pregnancy test, because obviously no one's operating on anyone that's pregnant. And number 2 is a nicotine test. You'd be surprised, smoking or vapes, which are very popular, it's nicotine. The addictive property of a cigarette or a vape is the nicotine. And nicotine is a vasoconstricting agent. So it's like if you have an artery that's really thick and big, nicotine clamps it down. It's causing a spasm. And so you minimize and decrease blood flow going to the area, and you need blood to heal and fight infections. So smokers we don't operate on. So we check that in their urine tests in the morning before surgery. If not, you operate on a smoker, their skin dies and they have a higher risk of infections because there's less blood flow going to the area. I think in 2024, we had to reschedule or cancel like 4 surgeries for a positive nicotine test. And I believe in this year there was one that was positive for pregnancy. So yeah, so that's why, you go to a board certified plastic surgeons because we try to minimize complications and operate on patients that need their surgeries. So to remember, a breast lift changes the shape, lifts the areolar complex, while the implant restores volume. The combination is great to do. Always go to a board certified plastic surgeon. Make sure you're happy with the doctor. You see a lot of before and afters, and hopefully they can match your breasts to a photograph. That wraps up our podcast. Hope you learned a lot about breast lift with implants. I'm all talked out. I'm losing my voice here. Thank you for listening. Follow us on our social media. You can call for a consultation, or you can do it on our Dr. Plano website, drplano.com. And don't forget about this is our last week or so of our holiday specials that run to the end of December. And again, Merry Christmas and Happy Holidays. Take care.